This is Greg with sportsrehabexpert.com. Today we're going to be talking about your knee cartilage and discomfort, pain that you might get behind the patella and on the surface of the knee joint as it articulates, as the knee bends. A lot of times people will go to the doctor, they'll get some scary information, scary reportings from the MRI, and it creates fear avoidance, and the individual doesn't necessarily want to move, bend their knee. They're fearful of deep knee bending. They're fearful of a lot of movements, such as going up and down stairs. Will it create more problems? And is there really any way to improve this issue overall? Today we're going to try to answer that question and give you a really simplified solution that's not so doom and gloom. Now, what we have to understand is that the knee joint is involved of a lot of different systems. We don't just have your bone or your skeletal system. Yes, we're talking about cartilage behind the kneecap and the surface here that the kneecap will slide on. Yes, that is part of the equation, but we also have a joint capsule that surrounds the knee, that it has fluid. So we need to understand fluid dynamics and physics that is involved with shifting of pressure of fluid in the joint and how that impacts the health of your cartilage. And then we also have to consider the muscles that go on over top of it, such as the quad, the tibialis, your gastroc, your calf muscles, and your hamstring, and how that's going to impact the mechanics, the biomechanics of your knee joint, because the efficiency of that mechanic is going to help with the position and how the knee moves and how the knee feels overall as well too, as well as the strength and resiliency. Because a lot of times these cartilage pain, you could also be having tendon pain and just coincidentally have cartilage breakdown, which is normal. It's normal to have these findings on MRI. Anybody over the age of 30 is going to have some changes that happen on MRI, x-rays, and things of that nature. A lot of times what the pain really is a weakness or a weakening or a decreased capacity in the tendon and the muscle itself. So maybe you're dealing with a muscle issue and not really a joint issue, and the joint issue is just what was found on MRI, because again, you're going to find something if you go take an MRI or x-ray. A lot of times if you're over the age of 30, it's just going to happen. It's inevitable, but it doesn't always mean that it's a problem either. So we have to look at all these different systems together to lead you to the best answer of what you should do for your knee. Now let's go back to the muscles first and foremost, because a lot of times patellar tendon type pain will manifest itself as anterior knee pain or create issues of tracking of the patellofemoral joint, and that's what's causing a lot of your problems. So a lot of times quad weakness and patellar tendon weakness is the real source of the problem. So we need to make sure we address that through an actual strength training program. Now, oddly enough, because your doctor has just created so much fear by telling you shouldn't bend the knee, if we look at things that actually strengthen the knee the most, it requires you to bend your knee fully. Ironically, the position of problem for a joint issue is at 90 degrees, because that's what creates the most compression of this patella down into the joint itself. Again, it doesn't mean it's a bad thing. That's normal, and the body should create that type of compression as you go down into a deeper knee bend, because that's going to create some stability about your knee. But this position of 90-degree bend is actually the max compression of your knee joint. So if what you're doing is always stopping at 90 degrees, you're just facilitating the problem even further. What you want to do is work quarter range depth on a frequent basis, because that's not going to create as much compression, and work full range of motion knee bending, because what will actually happen there, it doesn't look that way on a skeletal model, but what will actually happen, again, we have to think about all the different systems in the body. There's a joint capsule that involves fluid. That fluid brings nutrient to the joint, and it helps with the healing of the joint after an issue or an injury. But when we shift fluid and pressure around, think about this from a compression and an expansion position. The more we compress the joint on the backside, meaning this area here is going to compress by the hamstring and the calf touching each other, the more it's going to push the pressure out that way and expand the fluid pressure this way. And this is called in the research the wrapping effect. It's not very well known, but it plays a super important role of how your knee stabilizes itself in those deep knee bend positions, as well as how your knee shifts fluid pressure around your joint from a healthy perspective to get nutrients to your entire surface of your articular cartilage around your knee. Don't have full range of motion, you're not going to have full shifting of fluid pressure around the knee. Your cartilage is not being exposed to any sort of stress or tissue adaptation, and that's the reason why there's a continued degradation of the tissue itself. it doesn't, if you really think about this from a logical standpoint, if we think about what cartilage is, it's not quite bone, but it's similar. Obviously, it's a shiny substance that decreases fluid friction, but also fluid is a very big component of that. Hence why taking your knee through a full range of motion is super important, so you can actually move fluid pressure around, so we can contribute fluid to the equation of that hyaline cartilage. But then also, if we think about just bone substance in general, and any substance within the body for that matter, muscle too, is it's not going to change unless you impose a stressor on it to force it to change. Now, you can obviously do too much too quickly, but think of osteoporosis, a bone issue. That issue is decreased density of that bone. How do we improve that? We improve it through weight bearing. We improve it through physical exercise. Now, obviously, you can do that too far to the extreme and cause more harm than good, but some stress is necessary to create an adaptation. And that's all that we're trying to do with the cartilage if it's been damaged through an injury. Again, I would also consider that perhaps the muscle is actually the root of the problem, but if we're thinking that the cartilage is the sole problem, then it probably makes sense to load that tissue to a little bit of a degree and gradually, progressively load that over the course of an extended period of time. Obviously, there's circumstances where things don't work out so well. I have had to refer people for surgery in the past, but generally what you'll find is that these individuals don't have a gradual or normal progression. They'll be doing fine for a while, and then something seemingly meaningless or simple causes all the problem, and all of a sudden they have this huge flare-up that occurs. Those are the individuals where you got to start asking a little bit more questions. But if you're doing everything right from a load management perspective and trying to improve your range of motion, trying to improve your strength, and doing so over the long period, this isn't necessarily just a 4-week time frame. We're talking about for the rest of your life. We're talking about years that changes could occur. There's actually research out there from ACL repairs that when you put a new ligament into the bone, that ligament is going to tunnel down deep into that bone for over the course of 2 years. So that means over the course of 2 years after a surgery, there's still adaptation that is going on. So again, after an injury, we can't be so quick to just throw it under the bus and say it's going to be a problem for the rest of your life. You have to do the right things at the right pace and at the right intensity to see progression. But none of that is going to happen if you just have fear and avoid moving the knee 24/7. So if you want to do a workout program that has all of these considerations at play, is built into 4 different phases that allows you to continually cycle through these exercises to allow for continual adaptation over the course of time and actually make gradual progressive improvements in your range of motion, in your strength, and in your health, then I invite you to join our Sports Rehab Expert No Weak Links workout. This workout has a variety of different exercise progressions that allows anyone to start at any moment in time. And you'll have a one-on-one connection with me as far as being able to communicate, look at your technique, form of exercises, and make suggestions if you do have any pain or discomfort with exercises. So head on over to sportsrehabexpert.com and be sure to check out that workout program. Or you can email me directly at greg@sportsrehabexpert.com. If you're a rehab clinician or strength coach who is watching this, we encourage you to learn by doing, which is why if you join this workout program yourself, we have a special coaches and clinicians version of this plan where you get access to the workouts, but you get to perform the workouts and learn by doing, along with the educational videos that go along with the workout plan. So again, you can head on over to sportsrehabexpert.com to check out that service, or email me, greg@sportsrehabexpert.com, and we can get you rolling with that plan.